Hi there, my name is Brooke Brewer, and today I will be presenting on mental health disparities between men and women due to sociological factors and determinants. So first, before I get into it, I want to talk about what is mental health. So in the US, only about 70% of adults are recognized to be in a state of optimal mental health. So what exactly does that mean? Well, mental health involves a person's overall emotional, psychological, and social well being, and this can also affect the way people think, act, or feel depending on external factors within a society. So, when looking at society, mental health looks different among different individuals. So, some of those factors include a person's race or ethnicity, age, socioeconomic status, level of education, sexual orientation, and their gender. And gender is what I am going to be focusing on today. So, men's and women's mental health is largely impacted by gendered experiences and different societal pressures, which are generally reflected in the way that men and women are expected to look and dress, their occupation, different domestic behaviors, and their personality traits. So, how men and women are supposed to act within social settings. We see that men and women are more likely to have higher rates of mental disparities based on different gender inequalities that we see today in our society. So, next, I'm going to move into the influence of gender stereotypes. So, most gender expectations that men and women experience are due to social westernization or Western culture, where we learn from a fairly young age how sex and gender um, are easily replaced with one another, when in fact that is not exactly the case. Um, we're told that if you're born male, you must act one way, where if you're born female, you have to act a different way, and this continues throughout adulthood. We see that men are often told to act strong, invulnerable, and less emotional, while women are seen as more sensitive, more nurturing, and more dependent on men. So, according to the American Psychological Association, due to these different societal expectations that we have for gender, women are more likely to internalize their emotions, which makes them more likely to suffer from symptoms of withdrawal and isolation, which can lead to higher rates of depression in women. While men tend to externalize their emotions, which can lead to aggressive or impulsive behavior. And this is commonly seen in impulse control disorders and substance abuse disorders. So we see higher rates in those disorders in men. Another thing is that due to these stereotypes, women are um, more likely to experience the risk factors for common mental disorders disproportionately to men. So we're seeing higher rates in women than in men. On the other hand, when comparing the literature about men's and women's mental health, we see that research on men's mental health is severely lacking. And because of these socially constructed gender roles, um, men and women tend to experience mental illness very differently. So now we're going to move into the mental risks that we see in women, and kind of relating back to how women experience risk factors disproportionately to men. We see that women have a high risk for mental illness, and this is linked to specific gender inequalities. So, according to the American Psychiatric Association, the fact that women make less money than men, have a significantly higher poverty rate, are more often victims of sexual or physical violence, and are more likely to become caregivers, makes women more susceptible for risk of mental disorders. Also, due to women's higher risk of poverty, we see that this limits their access to basic health care, or preventative care, which is also likely to increase their risk. So, circling back to women's role as a caregiver, we see that women are not only caregivers for their children, but also for relatives or family members who could be suffering from mental or a physical illness. And this places a large amount of stress on the people who are caring for them. And due to these socially structured gender norms, this places women as the primary caregivers in those situations. So not only are they experiencing higher levels of stress, they're also given less social support to fulfill this duty. So another risk that we see is not just our psychosocial factors, but also including different hormonal factors and how those can influence women's risk for mental disorders. And we see this especially in depression and women's increased risk for antenatal and postnatal depression. We also see there are other studies that found links between infertility and hysterectomy relating to the onset of certain neurotic symptoms. So we see that these psychosocial factors like marital conflict or financial problems, along with different hormonal factors, can be a huge risk for women's mental health. Along with this, that we see is an extensive extensive knowledge about women's mental health. So this is very good, but we also see there's a link between this and a relation to why men's mental health may be going undocumented, but we'll move into that in later on. So here I have a graph showing the rates of mental health disorders in men and women. And as you can see, women have a lot higher rates than men in anxiety and panic disorders, phobias, obsessive compulsive disorders, and major depression. And this could be relating to gender-based roles, different stressors, or different life experiences that have negatively impacted women. We also see that women have a higher rate of post-traumatic stress disorder as well, and this could be due to women's higher prevalence of sexual violence against them. The only two that we see where there is a higher prevalence in men is in impulse control disorders and substance abuse disorders. So now I'm going to be moving into the mental health risks that we see in men. So one thing about men's mental health is that it is not well reported, and this gap in knowledge is a huge contributing factor in the disparities that we see in men. So according to the World Health Organization, the overall rates for psychiatric disorders between men and women are extremely similar, but certain gender differences that were focused on led to patterns of mental illness and more commonly seen in depression. So men and women both experience depression, but the signs and symptoms are expressed very differently. We see that men are more likely to act out of anger or aggression rather than sadness, which is commonly characterized by women. Another thing that we also see in men's mental health is that men are less likely to recognize the symptoms and seek treatment for those symptoms compared to women, which could also correlate to why women's rate of depressive disorders is seemingly higher than men's. Another thing is that men are also likely to display physical symptoms of a mental disorder, like an increased heart rate, tightening in their chest, and headaches. And in these cases, due to societal pressures on men, they're more likely to visit a doctor about the physical symptoms they're experiencing rather than the emotional symptoms. With this too, not being able to express those emotional symptoms, men are also more likely to abuse drugs and alcohol to help cope with their emotional symptoms. determinants. So along with this, we also see that while women are more likely to attempt suicide, men are more likely to die from suicide. And this is something that should be talked about more. And this is just due to the fact that men use more lethal methods than women do. And these can all be linked back to that mental disorders in men are more likely to go undiagnosed. So while we see that women have a lot higher rates in certain depressive disorders than men, this is not necessarily the case because most mental disorders that men experience go undiagnosed due to different societal pressures. So next here I have a infographic explaining men's mental health and some of the things that I discussed in the previous slide about why men are less likely to seek help than women, different social norms about masculinity, downplaying their symptoms and disconnection and isolation, and men utilizing different ways to cope. Depression is the major health problem that we see in men, and also that we also see that the suicide rates for men is extremely higher than women's in the United States. So some common misconceptions that we see about mental illness is that first, that mental illness is uncommon. 1 in 5 people in the United States will be affected by a mental or neurological disorder at some point in their life. So for someone or for people to say that mental illness is something that is uncommon or only affects people who are sick is not necessarily true. The next one I'm going to be discussing is that women are predisposed to disorders like depression. This is also not necessarily true due to the lack of support we have on the men's side, or the lack of information that we have about men's mental health due to different gender expectations, due to societal pressures that we see on men. So it's not exactly true that women are more likely to suffer from depression than men. Another one is that men and women experience the same signs and symptoms for mental illness. This is also not true because we see that men and women can both experience the same mental disorder, but they show the signs, they show different ways that they're undergoing that mental illness and different ways of coping with that. So it's important to recognize how those symptoms are different and to treat men and women individually about those symptoms. Last one is that you can prevent mental disorders. So mental issues usually arise from a biological factor or an environmental factor, but there is rarely a way to effectively prevent a mental disorder. The best way to help yourself with mental illness is to educate yourself on mental health and how different populations are affected at different rates. And that way, if you someday do have a mental disorder, you're able to cope with that and seek treatment for that. Lastly, I just wanted to talk about how mental health is a huge part of a person's overall health and well-being, and it's so important to recognize different symptoms and take action right away because mental health involves so many parts of a person. It is also critical to look beyond sex differences and examine how gender differences can be a huge influence for risk of mental illness, and we need to start bringing together men and women mental health and thinking more about the overall health and well-being of the person rather than looking at them as two different genders or two different sexes. And lastly, I think that There needs to be more research about this topic, and it definitely warrants further conversation about how different social norms that we see within our society can influence the risk of mental disorders and how we can take action and be better at understanding how mental health works in relation to gender. Thanks for coming and watching.